technician that would just do small IVs, little piggybacks of antibiotics and stuff, just do small IVs all day. We had another technician who would just do large IVs all day. We had another one that would just basically make up what we call enteral solutions that would contain, like, besides the nutrients, it would contain fat and everything else, because that was the person's only, source of nutrition. We had people that would make up those. So as a technician or a student going through this, it was always exciting because we would rotate your positions, and every day you would be doing something, something different. So it was kind of interesting to, to see that. And then I worked at a medium-sized hospital when I was doing one of my rotations in pharmacy school, my last year of pharmacy school. And, that's the one that I fell in love with the most and would have loved to have worked there. But like I say, it just really kind of varies. And the best thing I could tell you to do is just get in there. Do what you need to, knock through the doors, try to get into some of these places and see what it's all about. You're going to get that when you're in pharmacy school. I mean, granted, when you go through your rotations, they're going to try to send you to different places as part of your schooling so that you can see what the different areas are all about. But if you can get some of that experience, before your, 4th, 5th, 6th year of pharmacy school, I really encourage you to do that. And it will help in your schooling too, when you're sitting there trying to, memorize all these different drugs, to be able to say, hey, I know that's a diuretic. Hey, I know that's an ACE inhibitor or a beta blocker or an NSAID. It really helps.
Do you have any idea how many drugs you know for memorization?
No. I can't tell you.
Yes.
No. I can tell you that when I graduated from school in 1990, I thought there were tons of drugs men. And since then, there were 3 ACE inhibitors then. I'd say, there's probably 10 or more. Plus then they went on and made angiotensin receptor blockers, which was a whole other class of drugs, and there's probably a good, 6 or 7 of those. And more new classes have been developed, and it's just absolutely crazy. So continuing education is such an important thing. And also just staying up with everything and staying in the business. I have 2 children, and I took time off when I actually had them. But even if you're just going back into work, 5 or 10 hours a week, try to do it, because you are not going to keep up unless you stay active. So, you can read all the little continuing education articles that you want to, but if you're not in there staying up with stuff, you fall behind. You fall behind. And, thankfully, computer systems have been developed, and they are wonderful, but they don't have the latest drug interaction that they just found out about. That comes, a little bit later, that gets inputted, or you get an update. So it's very, very important and hard to keep up with everything, because it is so massive. So we will find, sometimes your specialist will do very well, like cardiologists will do very well with all the heart and blood pressure medications. But if they start to, if they want to prescribe something kind of like outside their realm, then it gets, a little iffy. And it's hard, as a pharmacist, you're not specializing. If you're a retail pharmacist, thankfully you can kind of discount all the IV stuff. But, you're not specializing in just one little area. You're doing drugs that treat the whole realm. So it's challenging, because there will be times where you basically say, I don't know. Let me research that, and I'll get back to you.
So as a consumer, does a pharmacist just cringe when I come in and say, I want to see the pharmacist and I want to ask about this, this, and this? Is that
I love that.
Because I always get the feeling that, you know, I'm disturbing the pharmacist, or they're usually back there in that very serious look, and they're.
And I have that look.
And you like, I want to talk to you, but I don't think you are going to want to.
No, but I will. You know, sometimes I have to. You know, depending on what's going on, sometimes I have to say, "Just give me a minute." You know, as soon as I finish, you know, something up, you know, I'll be there. But I was, you know, telling them earlier, that's the part of the job that I love.
But is it rude for the pharmacist tech to come and say, well, can I help you? And say, no, I want to talk to the pharmacist.
No.
So you can like pass the barricade there.
Yes.
So,
Yeah. And like I said, in some stores it's going to be easier than others. I mean, when I first moved here, and I didn't know about, you know, the independent pharmacy, and I kind of visited some of the other ones, you know, I was just, and I'm not picking on any pharmacy, but, you know, I went into one of the chain stores with my prescription, you know, being a pharmacist, and never once, you know, was I ever looked at, acknowledged, whatever, you know, by the pharmacist. I dropped off to a technician. I was given it by a technician. The technician didn't even say, do you have any questions, you know, for the pharmacist? You know, nothing. I had absolutely no interaction. And I was just like, oh my gosh, you know, that is not how pharmacy is supposed to be, and in my opinion. Now, you know, granted, you can't be everywhere at all times. And like I said, there are times, you know, you really have to multitask, because, you know, you might have, you know, 2 or 3 people on hold with questions, or a doctor, and you're trying to check a prescription, and then someone out, you know, like I said, someone out in the store has a question or wants me to show them something. So yeah, does it get hairy? It sure does. Do you have to multitask? You sure do. Do you have to have ears and eyes everywhere at the same time? Pretty much. But I guess that's what you get paid for. I don't know. Did you have a question?
I was just gonna be on that topic. I work at CVS Pharmacy. I'm a farm tech, and I have to deal with that too. Like where I have to go tell the pharmacist, hey, you have someone that needs consultation, and it's scary to go to the pharmacist and ask them. It's like, because you're bothering them, and they're like having to like think about the prescription they're trying to pass through and everything, and you're like scared to talk to them. But some of them are nice and want to be involved with the customers, and some other ones, you know,
Yeah.
they don't.
And as you said, you're just, you know, I'm just amazed all the time at the different personalities that you run into, and that's what it is, a lot of different times. But, you know, there are times where I've run into people and I'm like, and you chose retail pharmacy? Why? Because, you know, I don't know. Just like I would like to have a doctor that's going to spend time with me and, you know, be able to talk with me. You know, I would kind of like to, you know, have a pharmacist that's the same way. You know, is it an ideal situation at all times? No. I'm sure I've had people waiting on me that have gotten tired and walked out the door. You know, you don't win all the time, but, you know, the times that you can make a difference, you know, it's, to me, it's, you know, it's worth it. And like I said, there are a lot of times, oh, the thing that's driving me not slightly, is this, you know, we'll fill your prescription in 15 minutes or whatever. Of course, there's always all these different little restrictions and stuff that apply. But, you know, it's not a race. And there are many, many times where, like I said, we see stuff, and you have, you know, so like I said before, we are the last stop. We have to, you know, take the time and look. When I get a prescription, even if it's a refill, if it's a new prescription, but it's for something that the patient's been on already, I can't tell you how many times I've gone to plug in the new prescription, and the dose is different from what they were on the last time. So anytime that happens, I don't just automatically let it go through. First thing I say to the patient is, oh, excuse me, you know, Mrs. Smith, can you come here? You know, did your doctor tell you that they were going to increase your dose, or did the doctor tell you they were going to decrease your dose? And if the patient says, oh yes, you know, we're doing this, whatever, then I say, okay, thank you, and I'll go ahead and proceed on. I can't tell you how many times that they said, no, I wasn't aware that there was going to be any change. Make a phone call, and, you know, the nurse wrote it out wrong, or, you know, whatever. I can't tell you how many times I've called on a situation like that, you know, and the nurse or whoever, you know, has said, well, I just, you know, of course the doctor, remember the doctor is signing off on all these, but, you know, oh, I just wrote it based on what she told me she was taking. I mean, that's just great. You don't pull out their chart, you know, you're just going on the patient's word that that's what they were on. So, you know, we catch things, you know, that way. I had a situation the other day, Coreg, it's a beta blocker used to control blood pressure. It also controls heart rate. It helps the heart beat a little bit more slowly, but more effectively. Had a patient who was on a very low dose. It's given twice a day, unless you're on the Coreg CR, which is given once a day. They just got dismissed from the hospital, going through the whole list of discharge and all the medications. Well, besides bringing me the new things, they were bringing me some prescriptions that had been written a week or two ago before they went into the hospital from the cardiology office. You know, and all of a sudden, you know, here is, you know, I had Coreg, let's say 3.125 twice a day, and all of a sudden here is this prescription that reads Coreg 25 milligrams once a day. Well, big flags. There's no CR there. If there had been a CR, even then it came in 20 and 30s, not as 25. So not only are we basically quadrupling the patient's dose, but they've put it as once a day instead of twice a day, divided into, you know, two doses. I had to make probably about 4 phone calls on that because everybody kept passing the buck, or the nurse would say, well, yeah, if that's how the doctor wrote it, then that's how it's supposed to be. I'm like, no, it's not how it's supposed to be, you know, and I had to make another phone call and another phone call until finally they contacted the cardiologist on call, and I got to actually speak to the doctor and get it resolved, and it was never supposed to have been changed from how it was originally. So I said, these are the situations that, you know, if you're trying to be a time machine and just fly through those prescriptions, you're going to end up in trouble because someone's going to get hurt and you're going to get sued. So you have to take the time, you know, and do what you think is right and how it should be.
When you catch something like that, and you have the person on the phone, can you actually make a correction without having to get another prescription sent to you?
Yes.
How does that work?
Yeah, you take it down as a phone documentation. We can write on the prescription and document, you know, who we spoke to, you know, the date, you know.
And they don't have to follow up with sending you something else to confirm that? So.
No. No. The only time that a prescription cannot, and like I said, there's once again rules that go along with this, but we have controlled substances are divided into 5 classes. Class 1 is illegals. Then you have the class 2, which is like your morphine and your Demerol and, you know, all your really, it's like your highest controlled legal prescription. A C2 prescription cannot be changed. There's some minor changes. Let's say they bring in a prescription for, you know, 20 milligrams of amphetamine salts, and oh my gosh, we're out of 20 milligrams, but we have the 10 milligrams. So we can change and make it, you know, 10 milligram, take 2 tablets and change it from quantity 30 to quantity 60. But we cannot change the actual drug. We cannot change how often it is dosed, things like that. And on a C2 prescription, that prescription actually has to be rewritten by hand by the doctor and brought to us. And C2 prescriptions also can never be phoned in. They have to be always handwritten by the physician and signed by the, well, they don't have to be they do have to be handwritten prescriptions, but they always have to have the physician's signature. They cannot be electronically transmitted or phoned in. So.
Is there, keep asking questions. Are y'all ready to go? Is there any way to, like, you know, medical records, they're